So if you develop pulmonary thromboembolism, what happens? Blood clot blocks the lung arteries. So if you know your basic science from your school days, so if we need oxygen for our survival. So our oxygen, whatever we inhale, this goes into our circulation. So from where it goes is through the lung blood vessels. So normally arteries carry blood rich in oxygen, and veins carry blood which is less in oxygen. So the blood which is rich in oxygen is called oxygenated blood, and the blood which is less in oxygen is called the deoxygenated blood. So normally all the arteries in the body, they carry oxygenated blood that is rich in the oxygen. So they carry this oxygenated blood from the heart to the other organs like kidney and liver and intestines, all the limbs, brain. Even the heart gets its blood supply, oxygenated blood from the arteries. Those arteries are called coronary arteries. And what the veins does is, after the organs utilize the oxygen in this blood, they will return this deoxygenated blood through the veins to the heart again. So from the heart, through the left heart, you get the oxygenated blood to the rest of the body, and this deoxygenated blood goes through the veins into the right heart. So right heart receives the deoxygenated blood, and left heart pumps out the oxygenated blood. So after the right heart receives this deoxygenated blood is pumped into lungs through pulmonary arteries. So the pulmonary arteries are the only arteries in the body which carry the deoxygenated blood. All others carry oxygenated blood. So these pulmonary arteries which are carrying this deoxygenated blood, they receive the oxygen from the airway, from the air that we have breathed in. So this mixes with the blood and it becomes again oxygenated blood. This oxygenated blood goes into the pulmonary veins, and these veins will drain into the left heart. So the pulmonary veins are the only veins in our body which carry the oxygenated blood. All others carry the deoxygenated blood. So this oxygenated blood which is received by the left heart from the pulmonary veins, this goes into the rest of our body. So that is the importance of our lung circulation. So what is the lung circulation? It receives oxygen from the air and it gives the oxygen to the blood, and this blood goes into the rest of our body. So if there is a block in the lung circulation, the lung arteries, if they are getting blocked, so the oxygen supply to the body decreases. So all the organs can get affected due to decrease in the oxygen levels in your blood. Even the heart can get affected due to low oxygen, so its function will decrease, and the kidneys can get affected. So related symptoms will develop, like you will develop chest pain. Breathlessness means you will be longing for air. You are not able to get adequate oxygen inside, so you will be breathing rapidly, and your saturations will be less. Chest pain will develop, and you will feel lightheadedness, syncope, because your brain is not getting the enough oxygen supply. And commonly this is due to a deep vein thrombosis. So your leg may have swelling, pain, redness, increased local rise of temperature, and also your heart rate can increase.